Hello, this is Dr. Peter Leopold. I'm a chiropractor in North Oakland with training in sports medicine, functional medicine, and integrative neurology. I'd like to give you a quick overview of my approach to treating TMJ and sleep apnea. Anytime I'm confronted with a new complaint, I like to take a step back and examine it within the context of various systems which may influence it. This is especially true for the jaw because of its unique role in respiration, biomechanics, and neurology. Imbalances in the soft tissue are probably the most obvious contributor to pain and dysfunction in the jaw. I use a lot of active release technique to break up the fibrous adhesions which grow with chronic overuse and injury. Working on the masseter and temporalis are important, but I get a lot of return going inside and addressing the lateral pterygoids. But of course I look upstream and downstream and address any soft tissue injury that may be affecting the head or neck. Osseous adjustments or manipulation, especially when combined with soft tissue work, can be a powerful tool for restoring proper biomechanics to a joint complex. I always address the upper cervical spine, thoracics, and rib cage, but even imbalances in the feet or pelvis can contribute to compensation patterns in the neck and jaw. Cranial sacral therapy adds a refined but powerful layer to the treatment. Palpating the subtle respiratory movements of the cranial bones, we can find fixations and tension patterns within the sutures, which may be impeding the flow of CSF and contributing to pain and dysfunction. Nasal ballooning takes this concept a bit further. Nasal-specific technique involves inserting small balloons into the nasopharynx and quickly inflating them to mobilize skull sutures. This can improve breathing mechanics, cerebrospinal fluid dynamics, and much more. Breathwork can be a powerful and patient-empowering intervention. In addition to myofascial release on the diaphragm and accessory breathing muscles, I use mindfulness-based breathing practices to teach the patient to activate their own parasympathetic nervous system and improve breathing mechanics. Inspiratory breath training, as with the device pictured here, can also be a real game changer. A 2016 trial found that just 5 minutes a day over 6 weeks significantly improved the sleep quality index scores and even lowered the blood pressure in adults with chronic obstructive sleep apnea. While often overlooked, the tongue plays an important role in the development of the jaw and spinal stability. I use simple myofunctional therapy exercises to strengthen the neck, improve breathing mechanics, and decrease tension in the jaw. As with any part of the body, movement quality influences pain perception and vulnerability to injury. Simple jaw exercises refine motor control, balance the musculature, and give the patient work to do at home to continue the therapy. I always like to look into the literature to consider metabolic influences which may be contributing to the problem. For example, with sleep apnea, I found correlations with anemia, vitamin D, antioxidant, and mineral status. Finally, it may be necessary to consider underlying neurological dysfunction. For example, the jaw shares common brainstem nuclei with the vestibular system. Increased jaw tension may be a compensatory mechanism to make up for an imbalanced or weakened vestibular system. Functional neurological exercises can address these imbalances. I hope you found this short video interesting and informative. If you think I may be able to help you or anyone you know, please reach out for a free phone consultation or go to www.leopoldchiropractic.com to learn more. Thank you for your time.